This is an instructional video of how to administer TRT. So we just got our vial, we got our needles, we're pumped, we're ready to go. But what do we do? Well, it's not that hard, but I'm going to show you how to do it because if you've never done it before, it can be pretty confusing. So you're going to get a package of some needles, 27 gauge, 1/2 inch needle. A little bit different than how we used to do it. You're going to get your box with your testosterone in it. Now, it's going to have instructions. You got to read the prescription. Your dose could be 0.4 mLs twice a week on Mondays and Thursdays. It can be 0.5. It could be something else. But you need to read what your prescription says. Once we figure it out, we will know what to draw up. Mine is 0.4, so I'll show you. Next, we're going to open up the box of testosterone. And the vial's going to have a little cap on it. So you're going to pop that cap off. Takes a little bit of pressure. Then you're going to take an alcohol wipe. You're going to wipe it up. Make sure it's nice and clean. Do it for about 20 seconds. Time purposes. You're going to take your needle. You're going to look on that needle and you're going to see where the 40 is. See that? Yes, that's the 40. So I'm going to pop the caps off. I'm going to pull the plunger back. But I'm going to pull it back to like 50. Even though my dose is 40, I'm going to pull it back to 50. I'm going to take my testosterone vial. I'm going to take that needle, put it right in the center of that testosterone vial. Push down, flip it upside down so it's like this, straight up. Push the air with that plunger in. And then if you take your fingers like this, you can pull back. Now this is an oil, so it's going to take a little bit longer than normal. It's not a liquid, it's not like water, thin like water. The medium is an oil, grapeseed oil to be honest with you. So we're just going to keep consistent pressure, pulling back on that plunger, and you can watch the oil fill up. Now there may be some really tiny air bubbles, do not worry about that, it's not the end of the world. It's not a big deal. But obviously you want to minimize as many air bubbles as you can. So like I said, it's going to be a little bit slow because it's an oil. And then even though my dose is 40, I'm going to draw up 50. But pay attention, because this is what I'm going to do because I'm drawing up 50. So I drew up past the 40. That way I can push it up and get out any air bubbles and prime that needle. So I know that there won't be any issues when I go administer the testosterone. Now what we're gonna do is we gotta figure out a spot where we're gonna administer the testosterone. Some guys will do the stomach, some guys will do the glute. I like to do the glute and I alternate Monday, Thursday. You can do Tuesday, Friday, Sunday, Wednesday. I don't care as long as it's spaced out twice a week in, I don't know, 3.5 to 4 days. So all that matters. And we're going to do it subcutaneous. The intramuscular stuff, no bueno. So for purposes, we'll say, okay, we're going to do it in our stomach. So you'll take another alcohol wipe. You'll do this. You'll wipe your stomach for a good, I don't know, 10 seconds. Make sure it's nice and clean. What you want to do is you want to pinch that area, get a nice little chunk of fat there. Take your needle, hold it like this. You're gonna wanna go pow right in. You're gonna go right into the skin. You're gonna take that thumb and you're gonna push down. Now you're gonna need to put a lot of pressure on it because it is oil. So you're gonna push that down. It's gonna take about, I don't know, 5 seconds. And you can pull it back and it's done. Now you might get a knot. If you do, you just wanna rub it. It'll go away, I promise. Might be a little sore because of the oil. Now with our empty needle, what we do is we recap it, but you don't want to pick up that cap. You want to take the needle and scoop it into that cap. So you can scoop it into the cap, like so, push it down, and then you can dispose of the needle. That, in a nutshell, is the process of drawing up and administering your testosterone. Any other questions or anything that you need, just give us a call. We look forward to working.